have become so desensitized by, the killings, the murders, the molestations,
Sure.
right? The rape, all of that. And you're talking about individuals who've been through all of this.
Sure.
And they come to many of the mental health agencies with bags, and,
Wow.
and when Erykah Badu came out with that song, Bag
Bag
Lady,
Lady.
it's real.
Sure. I think we have a caller on the line.
Yes.
Good evening, caller. You're on the line with Curtis of In the End We Win.
Hi, my name is Lori. How are you?
Hi, Laura.
Hi, Lori. Wonderful.
I'm a big fan of yours, Natasha.
Hello. Oh, hi, Lori. How are you, Miss Lori TP?
I'm doing well. I have a question.
Yes.
I wanted to know, I know I've been cut off on and off with my service, so I hope that this question was not addressed already, but I'm going to go for it anyway.
No, we hear you fine.
I'm wondering if you think that it's common now that a lot of school shootings and even workplace shootings and a lot of the violent events have been going on in our country lately, if mental illness is being used as a crutch to protect those who are really just violent and maybe not mentally ill. And is there a way to tell the difference?
That's a great question.
That's a very great question, Lori. Well, you know what? There is a way to tell a difference, but you have some people who are very good actors, right? They understand that if they use the mental insanity, right, insanity defense, that the chances of them getting less time is greater. However, I would say that mental illness, and I would say it's difficult to really distinguish the difference between those who are just violent and mentally ill. But the fine difference is people who are mentally ill can also be very violent, right? If they're not treated. I hope that makes sense, right? And so in order for them to get the treatment that they need, you have to deal with the mental illness. What would make you want to take 17 lives? What would make you want to harm an individual? Like, there's a lack of empathy there. And when you're saying a lack of empathy, there's a lack of sensitivity there, which then says that something is not right. Something is not going well in that person's head, right? And so the question then says, okay, well, if they're mentally ill, are they not violent? No, it kind of works hand in hand. But then are people who are all violent not mentally ill? Like it kind of blurs together. And that's my thought because there's something happening that's not supposed to be happening.
Sure. With
that individual. I hope that makes sense.
She got cut off. Okay. So that's a good point. And I remember coming up, and we actually had hospitals that would take in mentally ill persons, like St. Eve's right here in Washington D.C. I know you didn't grow up in D.C., but you're probably familiar.
St. Elizabeth's.
St. Elizabeth's, right?
Yes.
It's now been converted. Where are those people going though?
And again, that is one of the biggest issues right now. Because I remember also when a person was hospitalized, and I'll get to your question in a moment, when a person was hospitalized, they were stepped down into a partial program, a program that would provide levels of support for them. Like it's like a step down program, teaching them the coping skills. They're not in a maximum level of security, but they are going to a program that will help them identify what their issues are, to help them develop coping skills, and then after a month or two in that location, because they will go there at 9 and they would leave at 4.
That's right.
Right? Mm-hmm. And then afterwards, after their time is up, right, they deem that they're able to go into an outpatient program, they step down. What we've noticed over the years is that there are no longer these partial programs available for individuals. So they go into a psychiatric ward, mental hospital, right? And they're soon as after 2 weeks, maybe less, due to insurance, costs, things of that nature, budgets being cut, they're in that hospital, sometimes maybe for just 48 hours. and then they're sent right back into the community. Really, and with a prescription. That's it. 48 hours with a prescription and told to find your way. Right? We do have social workers who will connect them to outpatient programs and get them the level of support, right? A discharge plan for them.
Sure.
But because these social workers are inundated with so many clients coming in or patients coming into these hospitals, it's sometimes hard to keep track of what's happening. So you have these individuals going into the hospital and going right back out. And what we also notice is that people who are ill use the hospital as a place to live.
Wow. Wow, I think we've got another caller.
Yes.
Good evening, caller. You're on the line with Curtis and Natasha. Hello.
Hello.
Hi.
Hi, I'm calling to the radio show.
Hi, you have a question or a comment?
I don't. I'm just happy to just now be calling. So I was thinking I could sit on the line and listen, but I'm not.
Can't do that. See, that's what that
Yeah, we're going to need you to either you can pull it up online on your computer or on your phone. You can go to VoxWave, that's VoxWav.com. And push the play button and you'll see us live and you'll be able to hear us. But the phone is going to be reserved for individuals who want to call in, ask questions or make comments or suggestions, if you don't mind. Okay? But thanks for tuning in and thanks for the attempt. I appreciate it.
Yeah, thank you.
All right, bye-bye. So we've got about 20 minutes left, Natasha, and I'd be remiss to, if we got out of here, and I tell you, there's so much more about this topic that we haven't even scratched the surface, obviously. But I know that you have something that you're doing. Is that dedicated just to individuals who are challenged with mental health illnesses?
Well, no. Okay, so for your viewers, let me just say this. I am also a clinical administrator. This is what I do, and this is my passion. But I'm also a etiquette therapist. That's my title, right?
Etiquette therapist.
Etiquette therapist. And so, very catchy, right? You like that, right?
Yeah.
And so, I teach individuals. I'm a certified etiquette trainer and coach. And so I teach individuals about presentation and building their self-confidence, right? And I utilize my skill, as they had seen in the very beginning, my promo video, I utilize my skills of teaching individuals. I was also a stylist, a makeup artist, right? And I've used those skills to support individuals who are in need of a presentation fix-up, okay? When I say presentation fix-up, teaching individuals skincare, posture, poise, how to walk, how to talk, how to shake a hand, and how to leave a lasting impression. Many of my contracts have been working with individuals who are in need of employment, right? And when you talk about whether it is only focused to one group of demographic or one group of individuals, I say it's open to everyone. And so when I say as an etiquette therapist, I teach the physical, right? But from a therapeutic perspective, I also teach individuals about being their best self, being very confident, knowing who they are, right? And walking in that, right? Because you can be dressed up, but as soon as you open up your mouth, people will tell what's going on within you, right? And so if you're not able to control or to cope and to manage whatever is happening within you, you can be dressed up all you want, but you're not going to be able to either get the job or even sustain the job or move into different arenas without being, stereotyped or, told that you couldn't get what it is that you wanted, right?
Sure.
And so I provide support. I did an actual level of like a workshop for homeless women, right? And people say, why homeless women? I say, because they also need an opportunity.
That's good.
They need an opportunity to know, because I'm going to be honest, many people have not been taught how to stand up straight. Right? And how to enunciate and open up their mouth and speak, and also sharing with them like you are someone, right? And therapeutically, I understand you, I empathize with you, and I'm going to teach you coping skills when you feel like someone is saying something to hurt you. But in all actuality, they're not saying it to hurt you, they're saying it to help you. But because you have mental health issues, or because you're dealing with trauma, you automatically are on the defense, and you want to curse them out real quick, right?
Sure. So is there a parallel between a lack of confidence then and mental health?
No, I mean, yes and no, right? Because you don't necessarily have to have a mental health diagnosis in order to not feel confident.
Exactly.
Right,
okay.
right. Because confidence is something that is taught, right? And confidence is something that innately some people just feel it, regardless of, their situations, regardless of where they've come from. They just know that regardless of what has happened to me in my past, I know that today I'm going to rule the world.
So for an example, let's take this gentleman who just created this issue down in Florida 2 weeks ago.
Okay.
Could he had gone through your etiquette class and perhaps changed his thought process on that heinous act that he did?
I wouldn't say that I don't have the magic pill to change anyone, right?
Okay.
But what I do is I have the ability to honestly, distinctively notice what's going on with them, just because of my skill set and my experience.
Okay.
To say that I would have had the ability to change his course of action, maybe not, right? But what I would have done was I would have put my hand on that pulse of what is happening and recognize that something is not right. Because in my etiquette classes, I ask individuals to stand up. Like I teach them how to, present themselves and stand up and say their name, as simple as just saying their name. And that young man who had been dealing with whatever trauma he had been dealing with, even saying his name in a level of confidence would have probably indicated to me that something is happening, right? And I would have had a conversation with him. So to say that I would have stopped or I would have, changed the course of his action, I wouldn't put that much on me, right? I don't have that much power.
I understand.
Right, but what I do have is the ability to detect that something is wrong.
Right.
I have the ability to say that something is not right and let's have a conversation.
Wow.
Yeah.
So etiquette means what? Knowing which side the fork and the spoons go on, and like BMW, bread, meal, water, right?
Yes. Awesome.
Is that real? Is that?
Look, yes. So
bread, meal, and water. Like your bread plate goes on this side, your meal is the big plate in the middle, and your water is on your left, right?
Well, the water is usually on the right. It's the other way
vice
around.
versa, or something like that.
Yeah. So is etiquette all of what you just said? Is that your question?
Yeah.
No, it's not.
No.
No. It's part of it, right?
Okay.
When I teach my courses, my workshops, I teach what to do, right? Because I always say to the people that I support is that I'm going to give you the rules of the game, right? Because if you play by the game, then you win. But if you don't know the rules of a game, you automatically get disqualified. Right? And so what I do is I tell and teach individuals how to play the game by giving them the rules. When you walk into a room, how do your nonverbal speaks a lot louder, right? Has more volume than your verbal. Absolutely, right?
Sure.
Individuals don't know that. Some people don't know that, right? It takes 7 seconds. Studies say 7 seconds for someone to make an impression, or you to make an impression on someone. 7 seconds for them to think about who they think you are based on your nonverbal behavior.
Interesting.
Yeah, it's very interesting, very interesting. So my etiquette class is all about teaching individuals confidence, teaching them how to live their best self. And that's what I preach. And that's why I live, and this is what I share, and I believe that if I have the information, I'm going to share it with the world. And I'm not going to always be there, so what I expect you to do is to share it with someone else.
Right.
And that person to share it with someone else.
And that's a good segue back into, and you used a powerful word that we try to use here a lot. You win,
Yeah.
right? And that's what the show is all about. So sharing information is, once again, something that this show is all about. So I'm glad you tuned in, because everything that has been shared tonight is for you to use.
Yeah.
Hopefully you can take it back and just utilize it, give it to someone else who may not have tuned in. But it's conversations like these that I believe that we need to start having, and you hit the nail on the head. I'm glad to see that, if nothing else, the conversation is starting to be had with our politicians and with the powers that be, who have the ability to make the decisions, even all the way up to the drug companies. And we talked about it briefly. However, it's critically important to me, because a lot of our kids today are just energetic and happy to be alive, and happy to go to school and be around their friends, and knowing that they're going to have recess, if recess is still a part of the curriculum now. But kids get a little excited. But I'm hearing that kids are also being targeted as having ADHD, and they're being placed on this Ritalin and these other medications that really just warrants to allow them to grow up a little bit, and that playfulness will grow out.
Absolutely.
Is that something that you also see? Because are you doing anything in the elementary schools in DC?
Yeah, I actually had, for a very long time, in many cities as well, I helped create clinics, mental health clinics within schools, okay, to primarily support the individuals that are in the schools who are having difficulty problematically, from a behavioral perspective, from an emotional perspective. And so I've seen it on a consistent basis, where you have children who are overly diagnosed.
Overly diagnosed.
Yes, right, because there's a child that you just described many children who are very rambunctious, very energetic, and it's often seen as, oh, he's ADHD, which is attention deficit hyperactivity disorder. That's what the acronym stands for.
That's correct.
Right, and that may not be the case. It may be that the child did not have enough sleep the night before, right? When I work with these families, I ask these pertinent questions. How many hours is your child getting,
sleep at night?
Yeah. How many hours of sleep are they getting, right? What are they eating? What does their diet look like?
Oh, goodness.
Right?
You've got food deserts all throughout the city.
Absolutely. In addition, is the child active in any particular sport? Are they doing something to relieve this energy that's pinned up, right? And if they're answering no to all of these questions, then I say, okay, let's look at changing something and see if you've put all of these things in place and the child continues to have difficulty. Then let's look at developing a mental health treatment plan to support that child, right? Right. So I think that many of those questions are not being asked, right? And these parents are not sure what to do when they have a child that is very hyperactive and they have an inability to focus, and I do believe that some of my counterparts are, overly diagnosing with these children, either with ADHD or, disruptive behavioral disorders, or, oppositional defiant disorders, or even bipolar, which that is kind of like like the nail on the board, right? Saying that this child who is 8 has bipolar disorder. It's possible, but not all the time. Right. We need to look at what's going on in that family. We need to look at what's going on with that child, and then make an accurate and effective diagnosis and treatment plan to support that child.
Wow. Now, is it me, or is it just this the idea or notion that it's all about money?
What do you mean?
it's easy to diagnose and label someone that so that these drug makers can continue to, because the government obviously sets the standard, right? And there are guidelines that as clinicians you guys have to follow, because then your license will be in jeopardy.
In what regard? I mean, I just want to make sure. And what follow the guidelines of what exactly? I know
in other areas of health, doctors can't tell you how to truly cure a disease or a situation that you're dealing with. What they can tell you is what you're dealing with, and then they can prescribe you a medication for it.
It depends on the doctor, right?
Does it?
For me as a clinician, it depends on me as a clinician. I mean, it's not unethical to provide a level of support for an individual and look at their strengths, right? And say, this is what I'm prescribing. Because as a clinician, I am not a psychiatrist, so I don't prescribe medication. But what I do is I support the family or the adult on what are your strengths? What can we support you in? These are some of the options that are available. And it's up to you to make the decision, because ultimately, you decide whether you're going to take that medication. Ultimately, you decide whether you're going to get counseling. And I'm a big proponent of therapy. Therapy is necessary and needed.
So holistic medicines, holistic medications, holistic therapies are not practiced, in my opinion, as often as they should be.
I agree.
And because of that, I think that is where we get to the root cause of these diagnoses and these problems, right? So since it is not being discussed, it is not the common practice for a lot of physicians, clinicians, or whatever, they stick to the norm of what, in my estimation, the government states or mandates, and therefore the end result is medication. Is that accurate? Am I off base?
No, you're not. You're not. I mean, I truly, I mean, this is being very transparent. I think that it is something that happens on a consistent basis, right? You know, everyone is shaking hands, right? If we know what that means, right? You know, I shake your hand, you shake my hand, you do this, and then I get this, right? But what I want your viewers to understand is that they have the right to choose. Right? You have the right to choose, and you have the right to be informed, and you do your homework, right? And don't just jump at the first thing that is told to you, right? Because what I find sometimes in our community, right, is that we take what is told to us for gold, right? And we don't do our own research. All the information is in books. Now everything you can go on Google, right? And you can do your own research, right? And be your own advocate, right? And speak up for yourself and speak up for your children, right? And there are moments when, or incidents or cases where medication is appropriate, right? If someone is delusional and they are hearing voices, right? There are medications that help subside, you know, and subdue those voices so they can be functional, right? Because I don't want to say that medication is not readily available, or medication is it doesn't work, it's not effective. I don't want to stand here and say that, because I've seen cases where people were prescribed the appropriate medication, they were able to live successful and flourishable and wonderful lives. Right. But then on the other end, you see individuals who are prescribed medication, they really don't need it. Right.
Wow. So that does happen.
Yes, it does. It does. Absolutely.
Even in our kids.
Yes, absolutely. Absolutely.
And then, can we add another caveat to that? How about in impoverished neighborhoods? Is it more relevant in our lower income neighborhoods? And
yeah. I mean, this is real talk.
It is real talk.
Absolutely. I mean, you know, you're talking about being overly, you know, prescribed medication, right? And being, you know, overly diagnosed, right? And not, and like you said, food deserts, right? Right? Not having the right fresh foods, fresh fruits and vegetables available,
right.
right? And then also not having, the up-to-date books in schools and things of that nature. We know that seems to have happened and has been going on for a very long time. But even when you live in these neighborhoods, and this is why it's so important that you have the freedom of choice. You have the freedom of choice to provide receive information and then share that information with the others who are overly prescribing this medication to your child, or saying to you that you don't have any other option when in fact you do.
Great.
Right.
Wonderful. So we've got a couple of minutes left, and Miss Natasha, listen, I thoroughly appreciate you
Thank
being
you for
here
having
tonight.
me. Thank you.
This was highly impactful, I believe, and an hour really goes fast.
It went by quickly, my God.
You were nervous in the beginning.
I was a little bit, but it's also a little cool in here. So I'm like,
okay. I really
was it noticeable?
No. Just leading up to it throughout the day, the emails, the texts, and all that stuff. But I really appreciate the work that you do.
Oh, thank you.
Because I know that it's needed.
Yes.
And I spent time in those trenches actually for a little more than 2 years. I was with that same agency, and it was partly why I am doing what I'm doing here today.